Welcome, girls. I just want to go through our philosophy on acne and how it's actually different. So what I want to start with is how acne actually forms, because unless you actually understand that, you're not going to get why we do things differently with Roccoco. So with acne, traditionally the theory of it was that it starts with hyperkeratinization. And definitely there's hyperkeratinization involved. However, new research has shown that that isn't actually the case. What it actually starts with is inflammation. And the reason why it starts with inflammation, it all comes back to the sebaceous gland. So what actually happens is with acne sufferers, we get an increase in sebum. Now, the reason why we get an increase in sebum, there's lots of causes there. It can be hormonal, it can be like from testosterone, from 5-alpha reductase, DHT is another trigger of it, and also foods can trigger actually increased sebum as well. And the way that they do that is by increasing what we call insulin-like growth factor 1, and that will actually increase sebum as well. So what happens when you increase sebum? I want you to imagine that you've got a cup and you've got some cordial in there, and you just keep pouring water in it. The more you pour in, the more diluted that cordial is going to become. And that's the same with our sebum. The more we produce, the less linoleic acid there is actually in our sebum. And so when we're producing a lot of oil, it decreases the natural amount of linoleic acid in our sebum. So what does that actually do? So when we've got low levels of linoleic acid, what actually happens is we get a disturbance in the skin barrier. And what that will then actually do is release interleukin 1A. So interleukin 1A will then hyperproliferate the skin cells. So that's the first most important difference with ours. So with treating the decrease in the linoleic acid and the disturbance in the skin barrier, we treat that with an oil cleanser. Now, if you are using benzoyl peroxide or anything like that, it will not work with our regime because benzoyl peroxide will not penetrate the pore. So by us using a sunflower oil-based cleanser, which is really high in linoleic acid, that will restore the normal levels of linoleic acid in the skin. It will also help with the skin barrier as well. Sunflower oil is also comedolytic, which means it dissolves blackheads, and it also prevents microcomedone formation, which is a microcomedone is the beginning acne lesion, which is invisible to the naked eye. You can't actually see it, and they can take anywhere from 3 months to 6 months to form. So that's how we address that. So once you've got interleukin 1 being formed, that is when you then get the hyperproliferation. Now, the hyperproliferation starts in the basal layer of the sebaceous gland. And so you're getting a hyperproliferation. So most companies treat it by exfoliating. Now, what is interesting is that there is absolutely no difference in the normal dissolving of your desmosomes, which are what anchors your skin cells together, in an acne skin versus a non-acne skin. Like, there's absolutely no difference. It is not a thing that the desmosomes do not dissolve properly, and that is primarily how peels work. They actually work, or fruit acids, they work by dissolving the dead skin cells and by also inducing calcium into the cell. So that's really important. What they have found is with acne is that there's abnormal levels of integrins, specifically A2, A3, and A5. Now, integrins actually make the skin cells really, really sticky. So that is one of the reasons why the skin cells don't shed off properly. Now, the other reason why that they don't shed off properly is because our lovely P. acnes bacteria forms this nice little sticky glue network called a biofilm. And what the biofilm does is it basically stops the bacteria from being destroyed. So it protects it. So once you've got that happening, again, the skin cells are super, super sticky. Now, the way that we address that particularly is with our plant harmonizing serum. So with our plant harmonizing serum, we've got green tea, we've got resveratrol, we've got saw palmetto extract, we've also got bellum candor. So all of these help to reduce the amount of oil that your skin is actually producing, which decreases or actually has a kick-on effect and actually will increase the amount of linoleic acid because you're not making as much oil, which will normalize the actual inside lining of your sebaceous gland. The other thing that they will do is resveratrol has been shown to destroy the P. acnes biofilm, and it also normalizes the integrin expression. So instead of peeling the skin, we're using resveratrol to normalize it, and there's no peeling involved. So it's a very, very different approach. However, you've got to understand that this approach can take anywhere from 8 to 12 weeks to really kick in. Around the 4-week mark, depending on their skin, you're not going to see a huge difference. So it is a persistence thing. The other thing with the P. acnes bacteria is you can actually kill them off. But dead P. acnes will still create inflammation, and inflammation is the trigger for acne. So it all starts with inflammation. So killing them off isn't enough. You actually need to have anti-inflammatories, which is why our range has such a strong focus on anti-inflammatories, because it basically solves that problem. We're killing off the P. acnes, we're also supporting it with anti-inflammatories at the same time. Our other point of difference is that with our Magnolia Honey Cream, we actually kill more than one type of P. acnes bacteria. There's type 1, type 2, there's actually more than that in itself, but the thing with tea tree oil is it doesn't kill type 2 P. acnes. So if you've ever had clients that have used tea tree and you've got a friend who's used it and they go, well, it worked for them, why isn't it working for me? It's because it doesn't kill all of the P. acnes types, it only kills one. And that's where you're sort of left. If you've got a different type of P. acnes, then it's not going to kill it. The other thing with that cream is that it actually contains what they call multi-drug resistance inhibitor pumps. So bacteria are very, very clever, and if you've ever wondered how drug resistance comes about, it's because they've got basically what they call F-lex pumps. And the simplest way I can explain it is if you think of a boat filling up with water and you've got like a bilge pump to pump the water out, that is literally what the bacteria do. So when they're being attacked by the antibiotic, they just pump it out, which is why you can get resistance with it. So there's ingredients in there, specifically Shulmugra oil will stop it from doing it, stop the bacteria from doing that, and also golden seal, which is in the cream as well. It is also a multi-drug resistance inhibitor, so it'll stop the pumps from actually working, and so it'll get that into the actual cell and actually kill off the bacteria.